Hi everyone, Charlie Piermarini here with Stephanie for MedCanna Today, bringing you another breakdown of another published article. And we just like to really expose our viewers and anyone that follows our podcast and our website to all different aspects of cannabis, good, the bad, the in between. And this article really hits home for Stephanie, who's a women's health focused PA. So I'm going to let her kind of take the reins on this. So Stephanie, talk a little bit about, you know, introduce the title and kind of tell us a little bit about the study and what you liked and what you didn't like.
Yeah, so this journal article, the title is Fetal Exposure to Cannabis and Childhood Metabolic Outcomes, the Healthy Start Study. It was published on the Journal of Clinical Endocrinology and Metabolism. It's also posted on PubMed. So basically, it's a study of 1,400. The sample size initially started as 1,410, but the subsample was 103 mothers, right? And so basically, what they did was that they they tried to link the relationship between maternal cannabis use with the adiposity percentage or BMI of the child later on in life. I'll start off with a couple things that I did not like on the study. Just how I mentioned in the first study, I'm grateful that they're actually doing research on cannabis and that these
Right,
big companies are actually funding them, right? Because this
right,
is progress and we need this. But
right.
I did not like the fact that they said that it was ethnically diverse Colorado-based cohort study. But when you look at the results section, they clearly state that it's non-Hispanic white women, older age, and their income is more than 70,000. So I don't agree with the ethnically diverse Colorado-based description that they gave in the beginning. Also, they mentioned that the maternal urine was collected at 27 weeks of gestation. So that's a week before your third trimester. Why they did that, I'm not quite sure. They didn't expand on that. Did you see anything in regards to that?
No, I didn't.
Yeah, I didn't see
Um,
anything either, but I did see that it said stored urine. So stored for how long, right? And we were talking earlier, you mentioned like how long does cannabinoids stay in your body or like how long does it stay in your urine?
right. It's fat soluble, so it can be weeks to months depending on how much you use, your clearance, your liver, and your kidney function. But yeah, I, uh, I definitely think this study, and they even say it, we provide a novel evidence to suggest an association between fetal exposure to cannabis with increased adipose and fasting glucose in childhood, a finding that should be validated in other cohorts. I think this funding, I was just looking at it, it's funded by the NIH. So it's a big grant with big institutions. I think it's an interesting study, right? And it's just more of like
Yeah.
a preliminary. And like you said, it's good that at least people are getting there's studies being exposed to this because the more evidence that we can find about how our body interacts with this, the better it's going to be for the field overall. And like we always say, cannabis is not for everybody, and it shouldn't be for, women that smoking cannabis while they're pregnant. There are risk factors because we don't really know all of the science. It does cross into the placenta, it does cross into breast milk. So we don't know the effects on a growing fetus. We don't know the effects on, a baby. And so I think the study just tries to really get, it's more of like a farming study, right? Just really trying to get some evidence in the data. But like you said, I think it's flawed, but I think it's a step in the right direction. The fact that they're actually breaking down the different cannabinoids they looked at, right? The fact that they're looking at CBD, CBC, THC, THC9, they're looking at THCV, CBDV. So they're looking at other cannabinoids, which no other study will ever do that. But
Right.
so
And
I
I
think
noticed that.
there are some good things about it, but I think overall, like you said, there's a lot. It leaves a lot to question. But the fact that the University of Texas, Colorado School of Public Health, these big time schools took the study on, right? That's pretty. I feel like that's really important to highlight that it's becoming more and more prevalent that studies are becoming done. But I'll let you kind of speak a little bit more about what the research design and what else you kind of thought about it.
Yeah, So yes, I do agree, and I'm also grateful, especially being an OBGYN, that there's actually more and more research being done on pregnant women or during
Hmm.
pregnancy, because it's been hard. But actually, this study, the moms had exposure to both tobacco and cannabis. So
Right.
that's also an issue that I have, because you can't really make a conclusion that fetal exposure to cannabis, this is the title, fetal exposure to cannabis and childhood metabolic outcomes. So
Right.
you're making a pretty strong statement when you're actually mixing in another substance that is as powerful, right? So it's like the previous study. If you're going to make a conclusion about cannabis, just study cannabis. Don't
Right.
include, like the previous study, alcohol, or now don't include tobacco. Obviously, we're going to see negative outcomes because these we already know that these things have negative outcomes.
Right.
So,
100. Yeah, 100%.
yeah.
Um, but I mean, I think it's tough because you probably see a lot of patients that come to the clinic and ask you about CBD, right? Like, hey, I can buy CBD at the gas station or at the local CBD shop. Should I be taking this? Can I continue taking pain or for my chronic headaches that I've been taking it for years? And what's your answer typically to them? What do you usually say?
So typically, when I have a patient that asks me if they can use CBD, I have to tell them that it is not FDA approved, and I my recommendations are just like any other supplement recommendations, which would be that the least exposure your baby has, the better, no matter how healthy
Hmm.
any substance someone tells you is. It could be mint, it could be raspberry tea. Like everything has
Right.
some type of risk. So the least exposure,
Right.
the better. But if you have chronic pain where you can go to work and you have to go to work and CBD is the only thing that works, I'm no one to tell you to not take it, because just how there's
Right.
not enough
Right.
research showing that it's beneficial during pregnancy for chronic pain, there's also not enough research showing that it has negative outcomes. So
Right.
I usually recommend for them to see a provider that has experience using cannabis and pregnancy, and that's how we go about that. Because I'm no one to tell anyone that you can't use it and you shouldn't use it, because we prescribe medications that are even worse. I mean, Tylenol is linked to heart conditions. It's now have been linked to autism. Zofran also gives heart problems later on, and we give it like candy for nausea and vomiting in the first trimester. So
Right.
if I'm
Right.
prescribing medications that have some risks, I mean, I'm not scared of CBD. So I
Right.
actually
No.
think that it's a better choice, but I
Right.
do want
That,
them
I
to
mean,
be educated, and that's why I refer them.
yeah, and that's a good point. To educate our patients. That's kind of why we're kind of on this crusade of really educating our fellow PAs, nurse practitioners, nurses, doctors, lawyers, everybody that'll listen to kind of the good, the bad, the ugly of cannabis. And um, the fact that the study was done is awesome. But like
Yeah.
you said, I mean, they showed. I mean, let's get to the results. What did they show? They showed that the people that were exposed to it had um, an association between fetal exposure to cannabis and increased adipose and fasting glucose levels in early childhood. A finding that needs a finding that needs to be validated in other cohorts. So they have a little bit more fat. They have impaired fasting glucose in early childhood. Well, honestly, like you were saying, what are the diets like of these kids? And how would their income level was fairly high, but what's their diet level like?
Yeah.
And so how are we controlling for that? Confounding variables. So, um, I don't know. These studies are very difficult, and you could sit and pull apart any study. But I think cannabis is so. Anytime the medical community gets any negative result for cannabis, they jump on it. So you say, we told you, cannabis is bad. Cannabis is the gateway drug, right? So, what do you think about that?
Well, I definitely don't think that it's a gateway drug. I think that it
Right.
allows you to, actually, for those who are addicted to nicotine or tobacco, it helps you with that addiction. There's
Mm-hmm.
other drugs that I've seen patients on, or medications that I've seen patients on, like
Suboxone.
Suboxone, yeah. for,
Hmm.
their opioid addiction. So,
Yeah, buprenorphine. Yeah.
yeah, so if you're gonna tell me that cannabis is a gateway drug, I'm gonna be totally against that. Like I don't
Right.
think that. But what was it that you mentioned before? You brought up that cannabis was a gateway drug. I kind of got stuck on that.
No, just talking about the results about how there could be some confounding variables about diet and exercise, variables between the kids and especially in early childhood, right? Like, what are you feeding them?
Oh, yes,
And so I think that's a big,
for sure. I thought
yeah,
about that also, but also they measured the urine at 27 weeks. These moms had a whole other semester that the study didn't take account, like didn't take into consideration, which based off experience with my patients, they start off super healthy the first and second trimester, and then the third trimester, they're like, F it, I'm eating whatever, I'm doing whatever,
right,
So that
right,
those last couple weeks could have also affected the fetal outcome, or the
right,
baby's, yeah, the
100%,
baby's BMI, because you could develop
right,
some type gestational diabetes in your third trimester, later in your third
right, yeah,
trimester, which does cause
yep,
a high, like, macrosomia, which is like a higher fetal weight. So
right,
yeah, that's something else that I didn't like.
right, yeah. In the third trimester, a lot of times, like preeclampsia or anything like that sets in, so a lot of women kind of tend to get less active. It happened with my wife. She's super active fitness instructor, but that third trimester really whooped her butt and she couldn't be as active. And so how much of that plays into this kind of type of study. But I think there's a lot of variables in the study to kind of control for, and I think it's a tough study. It was a tough
Yeah.
study.
I mean,
But I think, like you said,
going
yeah,
back to the diet thing, since they do state that the household income in most of the women that were studied was 70,000, I would think that their diet would be a little healthier, especially being in
hmm
Colorado. But I mean, I don't know that. They didn't tell us what kind of diet they had.
you, right, exactly. And that's but the thing that I always like to bring up about cannabis, and I don't know if we maybe have talked about it before, but is that the plant is so complex, and you're trying to study, right? Like we love pharmaceutical trials when they're studying one drug, lisinopril. It's a monomer. It's just one drug, right? And you're going to give it to a patient, and you're going to see how they react to it. Well, when you give somebody cannabis, right, unless you're given just THC or just CBD, it's very hard. Like, look how many different cannabinoids they were testing for, right? Like one, two,
12.
three, four, five, six, seven different
I said
yeah,
12.
12
Hmm.
cannabinoids. 12, yeah. So I mean, that's difficult to say because each of those cannabinoids have different effects on the metabolism and on neurochemistry, neurophysiology. THCV, right, is known for a weight loss, has weight loss side
Exactly.
effects.
That's why I was
I mean,
really
so
surprised.
yeah,
I was really, really surprised that they
right,
made that conclusion. And that's why, more as I read
right,
into it more and more, I'm like, the tobacco had to have a negative influence in that.
right. Now, I wonder, like, are people rolling tobacco in with cannabis to smoke it, or are these people smoking cigarettes separate of the cannabis? Like,
Yeah,
how are they
they
using
didn't
it?
say it. They didn't
So
say. So,
right, right. Was it a vape? Was it regular cigarettes? Was it? I mean, the research on fetal development and cigarette exposures, very, very, very well known, very well
yeah.
established. But now you're using cannabis too, and so is that already kind of setting it up for failure? I don't know. And you have a great
Hmm.
point, um, right? And so, yeah, I mean, again, another paper. I mean, I wish it's almost like they would give it a fair shake. Like,
Yeah.
hey, why don't you try and set these studies up to show the benefits of cannabis, right? People, I've seen professionally, all my patients, I've seen a lot of patients come off of opioids um, using CBD and cannabis. And, so I wish they would do studies that really set this up for success rather than for failure. But,
Maybe
um,
they need to come up with
this
like
is this is your
some
wheelhouse.
yeah, they need to come up with some cannabis research institute where all these studies that are going to be published have to go through, but not have
Right.
these big companies that are anti-cannabis publishing these articles, because they're going to be
Except for
biased.
I just read a big article about how the NIH has, I think, upwards of almost 9 patents on cannabis and CBD. And the longer they keep it on a Schedule 1 basis, where Schedule 1 drug means it has no beneficial medicinal uses like heroin, crack, all these things are Schedule 1. That's what cannabis is part of. Um, the longer they can keep it there, the less research that's done, the more benefit they're able to then have. Big pharma has able to come in and pay a lot of money in order to do research. Because for the longest time, that farm in Mississippi was the only place I was able to do research for the longest time. And so, but they're not growing good wheat, they're not growing good cannabis, they're not growing the cannabis that's representative of that the population's able to get, because it's just different. And so this plant's extremely complex. It's so hard to study. Um, and you know as well as I do, you have a plant that's in one side of the field versus the other side, has a totally different cannabinoid profile based on the sun, based on much water, based on the slope of the soil. And so
Even based off,
it's hard to study, and we
even
never get the studies that we want,
even
right?
based off the energy of the people that are growing it. Like, so much comes
Yeah,
into play.
right,
Yeah.
right, right. A lot of confounding variables. So leave everybody with a last word. What do you think about the study overall?
Um, I think that just be careful with the information that you're getting, even if it's coming from well-known organizations. Just make sure you read into it. Yes, it's good that they're studying cannabis and they're giving us more information, but just be aware of what you're reading and don't believe everything that you read or that you see.
What would you give this study on a scale of A, B, C, D, E, or I mean A, B, C, D, F? What would you give it?
A, B, C, D, F. Let's say I would probably grade it like honestly, a D. I really didn't like it at all. Yeah.
Wow. Okay. I was going to give him at least a C
You'll give him a
minus,
C
but all
minus?
right,
That's
all right.
fine. You
Uh,
could be nice.
give him a passing grade, but low. I'll be nice. All right. Well, that was a good study to break down, and I think we'll continue to do this, and we'll mix in some law and policy stuff. We'll have some interviews with some lawyers coming up. So, and if you guys have any questions, please reach out. And if anyone wants to be part of the podcast and can add and contribute in any way, please info@medcannatoday.com is our website. That's our email address. So we look forward to hearing from everybody, and thank you for listening.
Thank you.